Hi, it's Dr. Lorendi with the Center for Health and Longevity. I'm in my Santa Monica office today, and I wanted to take time and talk about cervicogenic headaches. Now, these headaches are very common. In fact, they're so common that they're often confused or misdiagnosed as migraines or tension headaches or headaches associated with sinuses and allergies. Now, I have patients that come into my office all the time with headaches, but sometimes they come in with headaches and neck pain. And that's the important part. The headaches are associated with neck pain. And that's because cervicogenic headaches are headaches that are the result of some type of neck issue. So the pain is referred or secondary from an issue in the neck. So what are the symptoms? Well, these headaches are associated to some type of neck issue. So there's some type of neck stiffness or decreased range of motion. So difficulty turning your head to the left, turning your head to the right, looking up, looking down. And many patients will tell me they just have this locked up feeling. They feel like their neck is locked up and it's difficult to move. And when they do move their neck, it increases the headache pain. And that makes sense because the headaches are referred pain from the neck. It's a referred pain pattern. So that means you could also have jaw pain. You could have referred pain behind the eye. You could have pain in the shoulders and even pain into the arms because it's referred from the neck. The pain can also be diffuse and dull in nature. It can also be moderate to severe, and it can be one-sided or both sides of your head. The pain can also be chronic. So these headaches can be chronic or episodic, meaning they're always there or they come and go. But when they come and go, there's always some underlying neck pain or neck issue involved. So what are the causes? What creates this? Well, it's usually the result of a slowly decreasing range of motion and mobility in the neck and shoulders. And that, coupled with poor posture and decreased activity, decreased exercise, and just a lack of stretching, it creates this dysfunction in the neck, a loss of movement. And the muscles can become rigid. And if there's increased inflammation in those areas, then you get trigger points and so on. It could also be the result of an old accident, like an old car accident where you got whiplash, or a sports injury, or some kind of fall. Maybe you got it diagnosed and you had some treatment, but you never followed through with it, or it just didn't work out for you. So now it's kind of coming back to haunt you, right? Those injuries, maybe there was ligamentous damage or something with the joints in the neck. So now the neck is stiff and that's creating headaches. It can also be dehydration. Maybe you just don't drink enough water, or maybe you drink everything but water. Maybe you drink way too much caffeine, or your diet is high in salt, which is kind of creating this chronic dehydration in your body. Maybe it's a poor diet. Maybe your diet is really high in inflammatory agents, so red meats, or processed meats, highly refined foods, right? Simple carbohydrates, lots of sugar, drinking lots of soda, right? And of course, if you put that all together, you've got a poor diet, you're chronically dehydrated, you maybe have an old injury, or maybe you're just inactive, you don't move enough, you're not exercising. All that can kind of come together and create this stiff neck, which then creates these headaches. So what's the solution? How do we fix this problem? And if it's chronic, how do we make it go away for good? Well, I think there's two approaches. One is what I can do for you as a chiropractor, and the other is what you can do for yourself. So I can use chiropractic and physical therapy techniques to get things moving again, to start working on the joints, the ligaments, the tendons, and the muscles in your upper neck and back, to start increasing flexibility and bring back that range of motion. What can you do for yourself? Well, you can start looking at your diet and maybe decreasing those inflammatory agents like too much red meat and refined foods and too much sugar and simple carbohydrates. Maybe you can start to increase water and decrease salt and be more hydrated. Maybe you can also look at what you're doing on a daily basis. Maybe it's your habits. Maybe you come home at the end of a long day and you sit on the couch or a chair that's not supportive and you watch TV for 3 to 4 hours. Or you're sitting far too long in front of your tablet or your phone in a compromised position and you're straining your neck. Or maybe it's ergonomics at work or ergonomics at home, the way you sit at your workstation. Maybe it's suboptimal and it's causing stress and strain. You don't really notice it, but at the end of the day, your neck feels stiff and tight, and that could be causing it. Whatever it is, the body doesn't live in isolation. Things don't live in isolation. So things are related, right? Your neck, your mid-back, your low back, your hips, it's all related. So if one's out, the other's out. So it's very important to be balanced, and it's very important to take care of one thing so the other doesn't become a problem. And that's the thing about cervicogenic headaches, is it's the result of neck pain and neck dysfunction that's causing this headache. Well, I hope you enjoyed this video and got a lot out of it. I certainly enjoyed making it. And if you have any questions, please don't hesitate to reach out to me at the office by phone or email. You can find my contact information on my website at smchl.com. And I hope you're doing well, and I'll talk to you soon.